release is a chronic condition where blood sugar stays too high. It happens when the body makes too little insulin or can't use it well. Insulin from the pancreas lets glucose enter cells for energy. When insulin fails, glucose builds up in the bloodstream. Long-term high sugar can harm nerves, kidneys, eyes, and the heart. Healthy eating, regular activity, weight control, and medical care prevent or manage diabetes. Oral hypoglycemic agents 1. Metformin, biguanide. Brands: Glucophage, Glucophage XR for Fortamet, Glumetza, Riomet. Generic: Metformin. Classification: biguanide. Mode of action: reduces glucose production in liver. Improves insulin sensitivity in muscle tissue. Decreases glucose absorption in intestines. Dosing: start 500 to 1,000 milligrams daily with meals. Maximum 2,000 to 2,550 milligrams daily divided into 2 to 3 doses. Extended release once daily. How to take: take with food to reduce side effects. Start low dose. Increase gradually over weeks. Side effects watch: diarrhea, nausea, bloating, 25% experience digestive issues. Rare but serious: lactic acidosis, vitamin B12 deficiency, hypoglycemia when combined with other drugs. 2. Glyburide/glibenclamide sulfonylurea. Brands: Diabeta micronase. Generic: glyburide. Classification: second generation sulfonylurea. Mode of action: stimulates pancreas to release insulin by binding to beta cell receptors regardless of glucose levels. Dosing: start 2.5 to 5 milligrams daily with meals. Maximum 20 milligrams daily. Long-acting: requires once or twice daily dosing. How to take: with meals, no food delay in absorption. Side effects watch: hypoglycemia, most common and serious. Weight gain 4 to 6 kilograms. Higher risk in elderly and kidney impairment patients. 3. Glipizide sulfonylurea. Brands: Glucotrol, Glucotrol XL. Generic: glipizide classification. Second generation sulfonylurea. Mode of action: stimulates pancreatic insulin secretion. Dosing: start 5 milligrams daily. Maximum 40 milligrams daily for immediate release. 20 milligrams daily for extended release. Shortest half-life among sulfonylureas. How to take: take 30 minutes before meals. Food delays absorption by 30 minutes. Side effects watch: hypoglycemia, lower risk than glyburide. Weight gain, headache, dizziness. 4. Glympyride sulfonylurea. Brands: Amaro. Generic: glympyride classification. Second generation/third generation sulfonylurea. Mode of action: increases insulin secretion from pancreas. Dosing: start 1 to 2 milligrams once daily with breakfast. Maximum 8 milligrams daily. Once daily dosing due to longest half-life. How to take: take with breakfast or first meal a day. Gradual increases every 1 to 2 weeks. Side effects watch: hypoglycemia, headache, nausea, dizziness. Possible increased cardiovascular risk. 5. Sitagliptin DPP for inhibitor. Brands: Januvia generic, sitagliptin. Classification: DPP for inhibitor gliptin. Mode of action: inhibits DPP for enzyme. Prolonging activity of GLP-1 and GIP hormones, leading to glucose-dependent insulin secretion. Dosing: 100 milligrams once daily standard, 50 milligrams or 25 milligrams for kidney impairment. Can take with or without food. How to take: once daily, same time each day. Side effects watch: upper respiratory infections, headache. Rare but serious: severe joint pain that may be disabling, pancreatitis. 6. Saxagliptin DPP for inhibitor. Brands: Onglyza. Generic: saxagliptin classification. DPP for inhibitor. Mode of action: inhibits DPP for increases in incretin hormone levels. Dosing: 2.5 to 5 milligrams once daily. Can take with or without food. Requires dose adjustment for kidney impairment. How to take: once daily, consistent timing. Side effects watch: upper respiratory infections, urinary tract infections, headaches. Increased hospitalization risk for heart failure. 7. Linagliptin DPP for inhibitor. Brands: Tradjenta generic, linagliptin. Classification: DPP for inhibitor mode of action. Inhibits DPP for enzyme. Dosing: 5 mg once daily only. No dose adjustment needed for kidney or liver impairment. Can take with or without food. How to take: once daily. Side effects watch: well tolerated, similar to placebo. Upper respiratory infections, joint pain possible. 8. Allagliptin DPP for inhibitor. Brands: Nezina generic, allagliptin. Classification: DPP for inhibitor. Mode of action: inhibits DPP4. Dosing: 25 mg once daily standard dose. Lower doses available for kidney impairment. Can take with or without food. How to take: once daily. Side effects watch: upper respiratory infections, headache, joint pain, pancreatitis risk. 9. Canagliflozin SGLT2 inhibitor. Brands: Invokana. Generic, canagliflozin. Classification: SGLT2 inhibitor. Mode of action: blocks glucose reabsorption in kidney proximal tubules, causing glucose excretion in urine, reducing blood glucose by 30 to 60%. Dosing: start 100 mg once daily, may increase to 300 mg. Take before first meal a day. How to take: once daily, usually morning before first meal. Side effects watch: genital yeast infections, urinary tract infections, increased urination, dehydration, diabetic ketoacidosis. Potential increased amputation risk, bone fracture risk. Endocrinology advisor. Dapagliflozin, brand name Farxiga, is an SGLT2 inhibitor used in type 2 diabetes. It works by blocking glucose reabsorption in the kidneys, increasing urinary glucose excretion. Typical dosing starts at 5 mg once daily and may increase to 10 mg. Take once daily, preferably each morning for consistent effect and adherence. Common side effects include urinary tract and genital fungal infections, increased urination, and volume depletion. Rare but serious risks include diabetic ketoacidosis. Consult your clinician for advice. 11. Empagliflozin SGLT2 inhibitor. Brands: Jardiance generic, empagliflozin. Classification: SGLT2 inhibitor. Mode of action: promotes urinary glucose excretion. Dosing: start 10 mg once daily, may increase to 25 mg. Morning preferred. How to take: once daily morning. Side effects watch: genital infections, increased urination, diabetic ketoacidosis, dehydration, low blood pressure. 12. Artugliflozin SGLT2 inhibitor. Brands: Steglatro generic. Artugliflozin classification: SGLT2 inhibitor. Mode of action: inhibits renal glucose reabsorption. Dosing: 5 mg or 15 mg once daily, morning preferred. How to take: once daily. Side effects watch: similar to other SGLT2 inhibitors, infections, dehydration, ketoacidosis risk. How to take: once daily. Side effects watch: similar to other SGLT2 inhibitors, infections, dehydration, ketoacidosis risk. How to take: once daily. Side effects watch: similar to other SGLT2 inhibitors, infections, dehydration, ketoacidosis risk. 13. Bexigliflozin SGLT2 inhibitor. Brons Brenshifi. Generic, bexigliflozin. Classification: SGLT2 inhibitor. Mode of action: blocks renal glucose reabsorption. Dosing: 20 mg once daily. How to take: once daily. Side effects watch: typical SGLT2 class effects, urinary/genital infections, volume depletion.
Thanks for watching this informative video created by Pharmacist RX. Stay happy, healthy, and safe.